It's great to see you, and tonight we're going to talk about anxiety and stress management. You're no doubt aware that the English language can sometimes be confusing for foreigners. You know, maybe people who live abroad, English is not always easy for them. And so you sometimes find in different places some rather strange signs, you know. And in Japan there was a bottle of medicine, a bottle of pills that said on these, take one 3 times a day until passing away. So I'm hopeful that the medication we will advise on will not have that effect tonight. It's probably only beaten by the sign that said, you know, fire extinguishers must be examined at least 5 days before any fire. And another one that sprang to mind was of a cloakroom in Germany where the men were advised to come and hang themselves in here. Anyway, that's just a lighter start to our talk on anxiety and stress management. It's an important topic because all of us will suffer from anxiety and stress at some stage in our lives. This is just a disclaimer to say that you know, I'm not necessarily advising you on personal issues this evening. That is more the province of your family doctor or other professional. But what I will do is hopefully be able to share with you some things that will be helpful and important. So bear with me while I just do out my notes here, then I don't have to turn to the screen all the time. One thing we might say is, well, what is stress? Well, stress is a feature of everyday life. We cannot live life without, at times, experiencing some degree of stress. And it can be good for you. If you don't have any stress in your life, then probably you're not actually achieving much in your life, because stress is one of the facts of life. And for example, if you are in a field with a mad raging bull and you're kind of in the middle of the field and the bull is about to come and get you, you have a choice. Actually, if you're a kind of young man with a sword and a cape, you can kind of think, well, I might have a go at this bull and see if I can kind of kill the bull. But most of us would probably run faster than we've ever run before and jump higher than we've ever jumped before to get out of that field quickly, out of the way of this mad oncoming bull. Yes? Okay. So that is what you would do in that situation. And of course, in that situation, what is happening is the body is changing, a massive amount of adrenaline is being produced, the adrenaline is getting the muscles keyed up, so you can kind of take that action, fight or flight, you know. And that's a very useful reaction, of course. And faced with problems or great difficulties, you know, that alarm reaction is very, very vital in our self-preservation. However, one of the things that can happen is that if you get overstressed and you're stressed all the time, then that adrenaline keeps on getting pumped out, you see? And if it keeps on getting pumped out, then actually, in the end of the day, you can become quite exhausted. And I would have people coming to my clinic very often who said to me, Doctor, I'm tired all the time. I feel exhausted all the time. Now, of course, there can be many causes for that, and any doctor in their right professional mind would make sure that some tests were done to exclude possible other medical causes. However, you know, sometimes that can be purely due to excess anxiety all the time about too many problems in your life. And so learning to deal with stress and anxiety is a way of helping you to overcome some of those problems and be able to live a life where stress does come in, yes, but actually you're not stressed out all the time and totally exhausted. And what happens when you're very stressed is that, in a sense, there's a mismatch between the external demands being made upon you and your ability to cope. Now, obviously, all of us have different abilities. Some of us can cope with a massive amount of stress, others with relatively little. And understanding yourself and knowing what you can cope with is actually an important thing in life. Understanding what you can manage, so there isn't that mismatch going on. Another thing to understand, and I think it's quite helpful, is the connection between your stress level and your performance, and that's shown by this graph. Now don't worry, this is the only graph this evening. It's not going to get complicated, but this graph is quite important to understand, and I'll try and show it to you. This graph shows the connection between the quality of your performance and the level of your arousal, okay? So, for example, if you are very low level of arousal and you're not actually doing something, you're probably asleep. And I'm looking around the room carefully. On the other hand, if your level of arousal is a little bit higher and you're not really being asked to do very much, then you might be in a state of boredom. And again, I can spot that fairly quickly, so I'll be on to you if that's the case. After that, the sense of mild alertness. Maybe this is where you're preparing yourself in the morning to go out to work, or you're doing something that needs a fair bit of attention, and you're alert, so the quality of your performance has gone up, and you notice the stress level, or the level of arousal. This is like the stress level, level of arousal. It's also gone up. And then at the top of the curve here, you've got what we call the optimal level, where your quality of performance is at the top and your level of arousal is moderate. Now, I hope tonight that I shall be at that optimal level, but if you ask me a very difficult question in the question time at the end, then I might tip over the top and become stressed. Now, I don't know whether you realize this, but when you become stressed, your stress is a little bit high, then you don't remember things too well. Has anyone noticed that? That when you're a bit stressed, you don't remember people's names. Well, I'm afraid I'm not very good on names at the best of times, but it's true. You don't do that because you're slightly stressed. And you notice here that with that increase in arousal now, the quality of your performance has actually fallen off a little bit. It's not quite at the optimal level. And then, of course, as that stress rises, then you get actually, frankly, anxious. You're aware of being anxious. And here, the level of your arousal's got up quite high, and the quality of your performance has fallen off again. And when you're absolutely panicking, then your level of arousal is very high, and the quality of your performance has fallen off. So that's sometimes helpful to people to understand that is one of the reasons why we do things like this, which is trying to help people to deal with the level of stress and the level of arousal, so that people can be helped, in a sense, to be up around here without falling off down here and getting so stressed and panicky that they don't cope very well. Now, all of us will have moments when we're here. We're bound to. It's life. But the idea is to see, well, can we manage to be more up here rather than all the way down here? Okay, so that's the importance of that graph, which is sometimes called the Yerkes-Dodson curve. So now what I want to do is just look briefly at what is anxiety. And of course, there'll be many, many different definitions here, and I'm just going to give you one. But anxiety is the feeling of fear that we get when faced with threatening or difficult situations. Now, most people will recognize that as anxiety. They get anxious when facing threatening or difficult situations. And you notice there that there's often a response in people when they get very anxious. And to deal with their anxiety, often they will take some kind of action to try and alleviate their symptoms. And that action might be they drink heavily, taking alcohol. They may smoke, or they may get into addiction problems with drugs like Valium, diazepam, or Librium, or other things, because they're using those to try and deal with that anxiety and that difficulty. Also, you notice that in married people, the anxiety rate is rather reduced. It's higher in single people, and the anxiety is twice as common in women as in men. Now then, what I want to do now is just briefly look at how anxiety and fear affect our minds. And what I'm doing here is just looking a little bit more at how anxiety affects our minds, affects our bodies, and also affects our relationships. Because those who are highly anxious will find that these things are prevalent. These things are what they're experiencing. So how can fear and anxiety affect our minds? Well, people can be hyper alert, on edge, very apprehensive, obviously worried and anxious. They may have panic attacks. I'll come back to those a bit later. They may find it very difficult to face situations. And this is true with many people who struggle with anxiety. They find a great difficulty facing situations. Now, generally speaking, it's better to face a situation and go through what we call the anxiety barrier rather than to pull back, okay? And, I'll illustrate that by the fact of learning to drive. Learning to drive is an anxiety-provoking experience. It's not easy to learn to drive. And you may hit a few people on the way through. Hopefully you won't, but it's not an easy experience. And you're basically trying to overcome your nerves and your anxiety so that you can master driving a car, because it's a very, very useful skill. And that anxiety, you say, well, actually, I need to face that. I need to go through that barrier to accomplish this particular goal, okay? Yeah, so you face the situation and you go through that anxiety barrier. And that's the same with many, many other situations in life. However, the anxious person often finds it very difficult to face that situation and would tend to withdraw. Of course, we need to be sensible about when we, press through that anxiety barrier, and sometimes it's wise to withdraw. For example, I made the mistake of trying to teach my daughters to drive. That was a mistake. I have 5 daughters, and I ended up trying to teach some of them to drive. Well, my second daughter, when I told her to turn left, ended up on the far side of the street, facing the oncoming traffic. And I was glad that that was the last time I ever tried to teach her to drive, because I decided it wasn't worth it. It was not worth going through an anxiety barrier. No, you can go and get a driving instructor. We'll pay for it gladly. It's because you realize that some things are not worth it. Likewise, if you're walking very close to a cliff edge, you don't want to face that situation. You want to withdraw. That's the sensible thing. So sometimes it's sensible to withdraw, but on other times, it's actually much, much healthier to face the situation and go through it. And people who have a tendency to anxiety find that difficult. If you don't have a tendency towards anxiety, you can just press on and do it anyway. But people who tend to be anxious find that difficult. But actually facing that situation and going through that situation is a very, very important skill. And if only people with anxiety could learn that, actually, it would be extremely helpful. Obviously, with anxiety as well, you get particular phobias and poor concentration. And you also get poor memory, which we've mentioned, sometimes tearfulness, feelings of exhaustion or depression, irritability or quick to anger, feeling unreal, depersonalization or derealization. Now, those are obviously big words there, and I'll try and explain them. Derealization is the sense that people get sometimes when they're very anxious, and actually they feel that the environment around them has changed, that things are actually become different and unreal. And I've had that experience just once in my life, because there was a time when I was facing my medical finals where I did become extremely anxious. I also had some problems in my life at that time. And I remember being in a pathology lecture, and it was a bit hot as well, and I suddenly felt everything around me had changed. It seemed so unreal. And I told a medical student colleague about this. He said, yeah, you're just highly anxious right now. I said, yeah, you're right, I am. So that's the derealization. The depersonalization is the sense that you yourself have changed in some degree. You're in a situation, you're very anxious, and you feel that you yourself have changed. That's the depersonalization. So that's how anxiety and fear can alter our thinking. So what about how anxiety and fear can affect our bodies? And here, really, every bodily system, in a sense, can be affected by anxiety in different ways. And of course, many of these you'll be familiar with. Headaches, dry mouth is another one, So I'm just having a glass of water. Headaches, dry mouth, sleep disturbance. People with anxiety often sleep very poorly. They often find it very difficult to get off to sleep because of all the worries in their minds. Shortness of breath. Sometimes people with anxiety, they don't realize that they're over-breathing, and they feel very short of breath and then actually breathe more heavily to try and compensate for that. And they end up doing what we call is hyperventilating. They're actually breathing too heavily. Sensitivity to noise is another one, and I sometimes like to say I can tell how anxious somebody is if I creep up behind them and drop a heavy metal object just behind them and see how high they jump. Well, that's a good way of telling whether somebody's on edge and anxious, that loud noise, that sensitivity to noise is there. Palpitations is awareness of your heartbeat, feeling your heart banging away. The palpitations is another thing there. Tiredness or weariness, we've already mentioned. Pains or tightness in the chest or jaw, and I'll come back to that in a moment. A lump in the stomach is also another one there. Feelings of giddiness, dizziness, unsteadiness, and actual fainting. Sweating, pins and needles, cold, clammy hands, difficulty swallowing, nausea or diarrhea, sometimes an irritable bowel kind of syndrome, increased frequency of passing urine, micturition, and ringing in the ears. All of those things can be the effects of anxiety. Of course, in any individual, if it came to your attention as a doctor, then obviously you would think of other things that could be causing those things. For example, thyroid disease can sometimes result in some of those symptoms, and other things can actually bring on those feelings. So, it may not all be anxiety, but it can be. All of those things can be related to anxiety. And then what would be the interpersonal effects of anxiety? Well, you see, most people will tend to react in one of two ways when they're feeling anxious or stressed. There'll be some people whose tendency will be to withdraw. And they'll say, right, I'm feeling anxious and stressed. I want to spend all this day in my room by myself, cut myself off. I'll just read a book or be quiet. I don't want to see anybody. So you tend to withdraw. Okay? On the other hand, if you're a slightly different personality type, then when you're faced with that anxiety and pressure, you will basically explode, verbally or even physically. And that's another way of responding. I'm not saying those are the only two ways of responding, but they're two common ways that we can recognize. Actually, if I respond this way, I will kind of, withdraw, and then I might lose friends through my withdrawal, or I'll explode and lose even more friends through exploding. So, all of those things can be the effects of anxiety. So, what I want to do now is look at what happens when you overbreathe. Now, here's the time for a little bit of participation, and I hope you don't mind. If you are suffering from a major medical condition, you don't have to do this, all right? Everybody else has to have a go, all right? What I want you to do is over the next 30 seconds is I want you to breathe in and out as fast as you can, okay? We do have another doctor in the audience if you get stuck, okay? But what I'm going to say is breathe in and out as fast as you can like this. Come on, join in. Keep it going, keep it going. I'm stopping because I've got a lecture, but can you keep going? Keep it going, keep it going, keep it going, keep it going. Okay, we'll stop it there. Okay, tell me how you felt. Lightheaded, dizzy, anything else? Sorry? Warm, yeah? Dry mouth, yeah? Sorry? Racing heart, yes, yes, yes. You see, what you've done there is you've actually produced many of the symptoms of anxiety. And I used to do this occasionally in clinic. If somebody, I felt was anxious, I wanted to show them what symptoms that brought on as a way of showing them that their breathing was connected to their anxiety, okay? Because actually, you see, when you breathe very heavily, like that, quickly and heavily, what happens is you alter your blood chemistry. And, the oxygen level in your blood stays the same, but your carbon dioxide level in the blood actually goes down. It falls. And when the carbon dioxide level in the body falls, actually what happens is the little arteries that feed the brain, called arterioles, they actually constrict, they get smaller. And that reduces the supply of blood to your brain, and you feel faint. And if you continue to do that, then you might actually physically faint. Now, fortunately, at this point in time, I haven't had anybody fainting on me yet when they've done that, but I'm probably going to hit a first at some stage and say, right, okay, I maybe overdid it slightly tonight, because you'll feel dizzy and you might actually faint. Because what happens when you faint is you overbreathe a lot, your blood carbon dioxide goes down, the little arteries feeding the brain shut down, and your brain doesn't work very well, you fall to the floor, and then you stop breathing briefly, and that rights the blood chemistry. You say, oh, what happened? That's what happened in the faint. So that's why that breathing is important, and I'm going to come back to that a bit later on. But it's shown itself particularly in panic attacks. Now, obviously, anxiety is a feature of quite a lot of kind of medical psychiatric conditions, such as obsessive compulsive neurosis, post-traumatic stress disorder, various anxiety states, phobias, panic disorders, and others as well. Now, I can't go into all of those because it's too much material, but what I will do is just briefly mention panic attacks, because panic attacks can be quite difficult for people to understand, quite difficult to manage sometimes, but understanding what is going on in a panic attack can be quite helpful for people. So here is some of the things that are going on. Shortness of breath, feelings of smothering or choking, palpitations, feeling the heart racing, chest pain or discomfort. My wife is also a medical doctor. We're both now retired. I'm a retired psychiatrist. She's a retired doctor, but she worked in dermatology. But she tells the story of what happened once in the accident and emergency department of the local hospital, in the city hospital where she was working then. And she says, suddenly into the accident and emergency department, there came a man, and he was behaving strangely. And what he was doing was this, and I'll just demonstrate this and see if you understand what this is. He was doing this. Now, who knows what that is? Come on, volunteer. Tell me what that is. CPR, yes. Because he had quite bad chest pain, you see. And so, because he had bad chest pain, he was convinced he was having a heart attack. And so, rather than wait for the doctors to diagnose his heart attack, he thought he'd do them a favor by resuscitating himself on the way into casualty, you see. So that wasn't entirely appropriate behavior, but that's what he was doing. Because, you see, in panic attacks, actually, you can get quite bad chest pain. In fact, some kind of chest pain or discomfort in 43%. And sometimes young people coming into the accident emergency department think that they're getting a heart attack, whereas in fact what they've got is a panic attack. Okay. Also, feelings of dizziness, faintness, feelings of unreality, numbness, tingling, flushes or chills, trembling or shaking. And here's the big thing. Often people with a panic attack, they feel they're afraid of dying. They're afraid of going crazy or doing something uncontrolled. In other words, there's that sense, I feel so out of sort, so out of order, that I'm worried I'm actually going to do something crazy, uncontrolled, or I feel so terrible I might even die. And so you can imagine in that situation, if they feel like that, and it's a public place, such as a local supermarket or something, they may feel, I'm never going to go to that supermarket again. Because last time I was there, I couldn't cope and I had a panic attack in the supermarket. So I'm not going to go there again. So there's that sense of avoidance, avoiding behavior because of that panic attack. And you find actually that there is quite a connection between panic attacks and a condition we call agoraphobia, where people are sometimes afraid to go into a public place, but afraid sometimes to even leave their houses. And I've had people on my list at times who've not been outside their house for several years when they're referred. Because it's extremely difficult for those people to face things because they feel panicky as soon as they set outside the front door. And we'll go into a little bit of how we can deal with that in a few minutes. So what I want to do now is just look briefly at some basic principles. This is fairly straightforward stuff. Basic principles on how we can actually manage some of the stress in our lives. And this can be quite helpful in a fairly straightforward way to understand some of the things that can be useful to us. So, obviously, if we are feeling stressed, it is very easy to blame other people. It's very easy to blame circumstances and say, it's everybody else's fault, or it's the fact I've got far too much to do, or all these things have happened. It is very easy to blame things, And sometimes we have to take the blame. Now, my fourth daughter got married on Saturday, and it was a lovely day for their marriage. It was raining a bit, but it was a fantastic wedding. But just as I was about to leave my home, to go and meet my daughter and then take her to the church, my sister was doing the flowers, you see, and she asked me to bring a little watering can for the flowers. And the only one I could find was one in the back garden that had some stones rattling around in it. And I wanted to get the stones out so I could take the watering can. And I couldn't get them out. So I thought, what I'll do is I'll put my hand inside it and try and grab the stones so I can then free it up and then take it with me so she can use it. And of course, what happened? I put my hand in, I couldn't get it out again. So I had this vision of walking down the aisle with my daughter holding my left arm around my right one because I've got a watering can. But Fortunately, I managed to get off. But as you can imagine, as the time was ticking away, I was feeling rather stressed. So stress can happen to all of us. Now, where was I up to? So yes, I was saying it's very easy to blame circumstances. It's very easy to blame others. Sometimes we just have to blame ourselves and say it's my own silly fault for getting my hand in there. So learning to take responsibility is sometimes helpful. Now, what I put up there is a stress diary can also be helpful. Now, there are different ways of doing that, but people can make it quite complicated. But simply, on a daily basis for a few days, you write down, what is making me stressed, and how am I feeling as a result, and actually what happened in that situation. What is making me stressed? How stressed am I feeling? Grade, if you like, from 0 to 10. And then what happens as a result, or what happens next. That can be quite helpful in understanding some of the stresses you're going through. And sometimes those stresses will be, yes, you feel under pressure because you've got so much to do in the next little while. Sometimes it can be stress because of problems coming up and you don't know how to deal with them, yes. But as you do that, sometimes people will find actually that stress is not necessarily about time pressure, it's not necessarily about concern about things coming up, it's actually to do with things like habits, or things that are unresolved from the past, or even difficult or broken relationships, and all that comes in. And as you write it down, you say, actually, the things inside as well that I probably need to find time to deal with it. So that stress diary can be quite helpful. Of course, there are unhelpful ways of dealing with stress, and we know what those are probably. Smoking, drinking, using pills or drugs to relax, collapsing for hours in front of the computer or television, over or under eating, yeah, I won't ask who's done that. Procrastinating, which is putting everything off so you don't have to face it, doesn't work, you've got to face it. Filling up every minute to avoid difficult issues, anyone ever done that? Won't ask for hands up, but I'm sure there are one or two around. And withdrawing from people or taking it out on others, those ways we've already mentioned. All those things are unhelpful ways of dealing with stress. So what can we do? Well, 4 things. First of all, avoiding it. Just before I retired, well, a year or so before I finally retired, somebody asked me, would I take on some extra patient responsibility? And this was another doctor who was senior to myself in that area. She was the clinical director. And I thought about it over a long weekend. I thought, no, I cannot accept that. I'm going to have to turn it down. Why? Because I knew that if I did that, I would get overstressed. I'm a person who does suffer a little bit from stress. But I knew that if I did that, I would just get overstressed and I would not cope well. And I would go over the top of that curve and not be coping well. And I thought, no, I've thought about it carefully. I'm going to say no to this. And, she was very gracious, obviously, but, I said no to that. And sometimes we need to do that. We need to learn to say no to certain things in our lives. We need to say no to taking on extra responsibilities because actually we can't easily cope with that. Obviously, there are times, to take them on and risk it because it's so important, but other times it can be important to say no. Secondly, of course, we can alter the way we respond. Now, this comes down to relationships very often because we find in life that relationships can make us stressed. And sometimes the way another person might treat us might make us stressed. But instead of dealing with it, we kind of allow it to happen, we don't speak up, we don't deal with it, and therefore we become even more stressed because things that you don't deal with actually make you stressed. And so sometimes it can be very helpful to, as it were, try and draw alongside that person, say, can we have a chat together, can we talk it through? Sometimes, you may want somebody else there with you or something, but usually on your own, can we talk this through the way that I'm feeling, the way that I'm struggling in this situation? And do it obviously with with a humble spirit saying, I might have got things wrong as well, but can we actually talk about this rather than just letting this situation carry on and the stress concerned with it? So altering the way we respond can be helpful. In other words, not allowing that situation to continue, but speaking up and trying to deal with it effectively. That is important. So altering the way we respond can be important. Now, don't go to your boss at work on next week and say, oh, this doctor here, and he said, I've got to come and talk to you and tell you what you're doing wrong. Because I don't want you to blame me for getting fired. So you have to be a bit careful, but in the right time, in the right way, that can be fairly important. Then, of course, adapting. And one of the problems with people is sometimes they're perfectionistic. They say, I've got to get 100% on everything I do. It has to be done this way. It has to be done this way. And sometimes adapt and say, yes, it's important to have standards, but we don't have to be perfectionistic. Doing a job well is good, but having to do it perfectly is sometimes beyond us. And sometimes to adapt a little bit. And then, of course, accepting things, things that, like learning to drive. You accept it because you realize the goal is there. They obviously, things that don't kill us actually make us stronger. And sometimes it makes us stronger to face things and go through them and accept that stress level. They used to say about the army, if it doesn't kill you, it'll probably make you stronger. You'll be better at the end of it. That kind of approach. So those are 4 things we can do with stress. It's also important to learn ways of relaxing. Obviously, there are so many ways here. But in all areas of mental health, exercise is particularly important. Exercise is very good as a preventative for mental health stuff like depression and anxiety. It's also very helpful in dealing with it. And exercise makes you stronger and more able to deal with your stressed feelings. So exercise is very valuable. And obviously exercise is relaxing. It sends out the endorphins in your brain and you feel relaxed as a result of your exercise. So different things I put up there: walking, exercise, friends, music, garden, hot bath, massage, pets, nature, books, comedy. All of those things can be very valuable. Certainly when I was very, very busy, because there are times when I've been not only doing a full-time job, but also involved in a lot of church leadership, etc. And finding that was, I needed to find a time when I could truly relax because I was just so busy. And I used to find that actually saying to myself, right, I'm going to take an hour in the evening when I'm really just going to relax. I'm not going to take phone calls. I'm not going to deal with other things. I'm just going to take some time out. And I found that very, very useful. I might go for a walk. I might play a bit of chess or something else. Just, relax. Do something relaxing, just for 1 hour, and then get back on with everything again. And that process was very helpful as a way of dealing with what was a very, very stressful situation. So do something you enjoy every day. Keep in touch with others. Keep your sense of humor. Strengthening your physical exercise. All of those things are important. And then another skill that is important is time management. Now, we don't have time to go into this fully, but almost without exception, stressed patients find it difficult to imagine how long a task will take. They tend not to take into account unexpected events like a phone call. They believe that what has to be done dictates the time allotted instead of time available dictating what can be done. Now, I want to explain that just a little bit. If you're, say, a busy mother and you are facing the situation of you've got half an hour and you feel you've got to pick up your children from school, you've got to get lunch on, and you've got to also make an important phone call, and you've got to get some shopping in, and you say, right, I've got to do all those things next half hour, what will happen? You'll get so stressed trying to deal with them all that actually you won't do any of them effectively really well. Much better to say, I've got half an hour. Now, what can I do effectively in this half an hour, and what is priority? The priority is, I must collect the children from school, and I better get the lunch on. The phone call will wait, the shopping will wait, or we'll find another way to deal with it. So learning to plan your time and say, what can I effectively do in the time available, is a very important time management skill. And sometimes we don't realize that stress reduces our efficiency, and I've mentioned that. One of the things that is very, very helpful, and it's very simple, is, I mentioned breathing techniques before, but learning some breathing techniques. Now, as I mentioned before, you remember when we did the last exercise, we all breathed very heavily for half a minute, and we got tense and anxious and fainting and whatever, feeling faint. Now I want you to do something else, and I want you to breathe slowly and deeply, and then tell me how you feel. So what I want you to do is breathe in through your nose and out through your mouth. Tend to use your abdomen more than your chest, and breathe into the count of 4 and out to the count of 7. So let's try it and see. In, 1, 2, 3, 4. Out, 1, 2, 3, 4, 5, 6, 7. In, 1, 2, 3, 4. Out, 1, 2, 3, 4, 5, 6, 7. In, 1, 2, 3, 4. Out, 1, 2, 3, 4, 5, 6, 7. Keep it going. In, out, in, out, in, out, in, out, in, out, in, out. Okay, how do you feel? How do you feel? Nice. Sorry? Relaxed. Anything else? Nice, nice, relaxed.
Laughing because it feels good.
Laughing because it felt good, yeah. Yeah, you see, you feel relaxed, you feel calm, you feel nice, it's good. Now, obviously, if you have somebody prone to panic or severe anxiety in a situation, and you can say, look, sit down and slow your breathing right down in that kind of way, and do that for just half a minute, you'll feel better. And then you can face it. So in other words, what you're doing then is you're helping people to feel back in control. Because the people with panic attacks feel, if I go there, I'm going to be out of control, I won't cope. Well, actually, slowing things down, calming yourself down in that kind of way can be very helpful. Likewise, there are types of muscular relaxation where you tense your muscles, you hold the tension, and you relax it. And you tend to start with your feet, you kind of tense to the count of 7, 1, 2, 3, 4, 5, 6, 7, hold it, 1, 2, 3, 4, 5, 6, 7, relax, 1, 2, 3, 4, 5, 6, 7, and go through every muscle group of your body, going through your lower legs, upper legs, etc. And that, again, muscular relaxation can be extremely valuable. Problem-solving techniques are another thing that is just very, very simple. I'm not saying anything complicated here, but it is very useful. And I keep a piece of paper and a pen by my bed, okay? My wife doesn't, but I do. Why? Because I know that during the night I might think of things that I have to do the following morning, or I might think of things that actually I need to consider more carefully, or whatever. And so I'll make a practice of writing them down. Why? Because I know if I don't write it down, it will play on my mind, and my mind will just go round and round on that thing, and round on it, and I won't sleep. But if I write it down, go back to sleep. Write it down, go back to sleep. It's just a very simple technique. But in the morning, I'll look at that list of 1 or 2 things and think, yes, I need to deal with that, and then think, no, I don't need to do anything about that, that's fine. Because when I'm awake and, the following morning, I'll be in a much better state to sort things out. Because I don't know about you, people have different clocks, but I tend to find in the morning time, I can sort through things pretty quickly, whereas later in the day, I would struggle to sort them out quite so effectively. So, you learn by your experience. And so I find that writing things down and then examining the problems in that kind of way can be very valuable. And certainly when I first went into being a consultant psychiatrist, having been a junior grade for many years, I found that, you know, at the end of a day, the increased responsibility meant there were 50 things you had to think about. And I'd write them down, and then I'd ask myself a question. And the question was, what am I going to do about this tonight before I clock off? What am I going to do? What am I going to do? And I'd say, well, yes, I need to deal with that. And yes, I must make that phone call. Can I do anything about these other things? No. Right. Screw it up, throw it away, relax and enjoy the evening. Now, you know, that simple technique I found very helpful as writing things down and looking at things in that kind of way. Obviously, you know, with people who struggle more with anxiety, then there are medical things we can do. And cognitive behavior therapy is very valuable. As a way of helping people to deal with their anxious thoughts. And as I've mentioned before in the previous lecture I did, it's based on the following, that there's always a thought that comes before the feeling, and here that thought would be a feeling of fear. You know, thought, I can't cope, I'll never manage in the supermarket. The thought is I'll never manage. The feeling is the fear. And those thoughts sometimes go unchallenged. And then there's a connection that with behavior, as you think your thought, I can't cope, the feeling is the fear, the behavior is avoidance. Okay, that tends to happen. And dealing with that at the level of the thought and showing people they can cope and they can overcome that fear can be very helpful. These thoughts are usually unnoticed, go unchallenged, the thoughts are generally incorrect, and if the thoughts are changed, then the feeling gets better. So cognitive behavior therapy is very valuable, and sometimes doing exercises with a therapist can be useful. For example, if you suffered from agoraphobia, going with a therapist a little bit more each day, practicing that kind of thing can be very helpful. Also, with the fear and anxiety people get with obsessional disorder, again, that can be very helpful. With terms of medication, then antidepressants can be quite useful. But best when combined with other kinds of help. To be honest, Valium and other sedatives, you know, you're best to avoid them if you can. However, they are still very useful drugs. And in short courses for extreme stress, they can be valuable. And sometimes on an intermittent basis, where people are struggling with particular situations, they can be valuable. But best not to give them long term because there is a problem with addiction to them. Okay? But they can be used when the anxiety and panic is severe. Sometimes, very occasionally, we'd have somebody in hospital with very severe anxiety and panic, and in that situation they can be very, very helpful. Further resources, you know, there are online cognitive behavior therapy things you can do. Beating the Blues, Mood Gym. Living Life to the Full is a very good course online. And people will, if they're very well motivated, can do that kind of work themselves. However, often support from the therapist is advisable. And also, a range of booklets on aspects of anxiety, panic and CBT, cognitive behavior therapy, are available for download from the website of the Royal College of Psychiatrists. Those are free booklets you can download, and they're very, very valuable on all aspects of anxiety. Finally, and I've referred to this in my previous lectures, talks, the psychosocial benefits of religious practice. This is work done by Professor Patricia Casey in Dublin, and really she's looked at the connection between mental health and religious practice. And what she's found is from a study of over 300 papers, those 300 academic papers, that there is a positive benefit for those who regularly practice a religious faith. And those benefits are seen in terms of less depression, less suicide, live longer, Marriages hold together better, you cope better with bereavement, and young people do better in terms of less drugs, alcohol, and other problems. So those are some of the benefits that she picks out. Of course, anxiety would come in there because anxiety can be also related to depression. In this series, I separate out depression from anxiety, but obviously they can occur together. Now, I know in a talk like this, I can't possibly cover every angle, but you may have one or two questions that you want to ask me.